Over 3 million Americans are currently living with a disease that typically affects your vision, and that is glaucoma. Now, January is Glaucoma Awareness Month, and to tell us more about the disease is Dr. Ronald Swendris from Eye Center South. So good morning, Dr. Swendris. Thank you for being here.
Good morning. Thanks for inviting me.
Of course. Now, glaucoma, I think a lot of people that are outside of the medical field in any aspect, they hear a lot of different names for different diseases, and they kind of get them intermixed. So exactly describe what glaucoma is.
Very good. Glaucoma is actually something that a lot of people do not know much about. It's a painless, slowly progressive optic neuropathy. And so it causes damage to the optic nerve in the back of the eye. And if there's damage to the optic nerve, then you gradually lose typically your peripheral vision. And it's something that people don't necessarily notice. So glaucoma damage can often sneak up on you, and you don't necessarily know it's there.
Gotcha. And obviously January is Glaucoma Awareness Month. So what is this initiative, and what is the main purpose you guys are trying to drive home?
The key word there is awareness, because again, glaucoma happens without necessarily having any symptoms. We often look for risk factors, and we have a number of risk factors that can cause damage. Among them, family history. If glaucoma runs in your family, you're at much higher risk for damage. Age. Glaucoma happens as you get older, especially after 60. Race. People, African Americans, have a much higher risk of glaucoma, and it's a much more severe disease in African Americans. And the other risk factor that's common is the pressure inside the eye often is high. And again, that pressure can cause damage. So those are the risk factors we look for when you have an eye exam.
Okay, and so you are someone in those categories of risk, and you go and you find out that you do have glaucoma. What are some of the ways you can treat it or mitigate it in any way?
We have some great treatment for glaucoma nowadays. The first line of treatment, if you will, is various kinds of eye drops that reduce the pressure to a safer level. We have laser treatment that works very well nowadays. And then we're also developing many different types of glaucoma surgery. And the surgery, we're trying to develop procedures that have less risk and are more successful. So if we find glaucoma, we have lots of very good treatment for it.
Gotcha. And then if someone wanted to just get a checkup, where can they go? I know you practice at Eye Center South, but there are other places. Just any doctor, eye doctor specifically?
That's the nature of Glaucoma Awareness Month. I know COVID has a lot of us delaying a lot of our health care nowadays. Get to see your eye doctor, okay? Eye Center South and Vision Center South, we're very good at detecting and treating glaucoma, but your favorite eye doctor, as long as you get a good eye exam and they take a really good look at your optic nerve in the back of the eye, that's what you need. So see your favorite eye doctor sometime this year, especially if COVID hopefully gets better.